Good afternoon to everyone. I am myself V.Haridass, Assistant Professor, Department of Mental Health Nursing, working in E.S College of Nursing. Here we are going to look about family therapy. It is a branch of psychiatry in which the individual psychiatric symptoms is separately related to the family in which he or she living. Thus, it is focused on the treatment. It is not only the individual but also the family. It is first started by Batson in the year of 1956 and it was well developed by Nadu in the year of 1958. The family therapy, it is essential intervention for the family system to change the family. Family, it is a united well-being treated for the interaction which will become better among each in the family members. Family therapy, it is a type of psychotherapy which involves all the family members of nuclear family or a separate family or step family, and it in case some family members in the family which may extend it to the grandparents and etc. The therapist or a treatment of the therapist conduct multiple sessions to the families which help with the important issues that may be interferes with the functioning of the family and their home environment. The principles: change your behavior and you will change your relationships. The aims of family therapy, which helps the family members to clarify and express their feelings toward one another, to improve the interactions of the family system into the social system, which may remove the generational gaps and which establish good communication pattern, to develop the great mutual understanding. Next, we'll move on to the purpose of family therapy. It includes improving the communication skill, facilitating autonomy, increasing empathy, fostering flexible leaderships, improving the role agreement and enhancements, reducing the conflict, facilitating the symptomatic improvement, enhancing the individual task which is made going to the performance. The types of family therapy: there are 6 family therapy. Individual family therapy, which is focusing on each single member in the family members that will have single therapist. Conjoined family therapy, it is a nuclear family where it will be used for nuclear families. Couple therapy, which is made for the marriages, and multiple group family therapy, which consists of 4 to 5 families meets in a week together and which will be discussing about the conflicts. Multiple impact therapy, it indicates that several therapists come together with the families in the community settings and they will be projecting about the impacts about the therapy. And network therapy, it indicates that it will be a chain of network. The family, friends, neighbors, professional groups and any other in the community members can be participated as chain of link which may have good interventions. The points to be remembered during the therapy. Here, always we have to go along with the family process, the way to working which they are living and based on the mood and communication pattern, which we want to give the ears toward their words and respect their cultures and values, give the weightage for the strength and weakness of the family members, to know about the available resource which will respect the supporting family system or else subsystems which will be help for the corrections of problem arises and help to resolve all the problems. The treatment and treatment unit and settings. The family consultation should be practices which supposed to be participated in assessment phase as a family therapy. So here we will be having the different views that will be taken depend upon the goal should be achieved. The children with the age group of 4 and below are not often including in the family therapy. If often refuse or else they are having the traditional practices. Here the person with some problems in the relationships and interdependent about the symptoms, symptomological which one another can reflecting on dysfunctioning of the family background. So if the people, those who are having these kind of indications, maybe end up with the family therapy. And the psychiatric illness which required the family therapy is neurosis, that the patient who is having anxiety, depression and adjustment disorder, contact and emotional disorders, which most often seen in childhood period, and the substance use disorders, sexual dysfunction disorders, and schizophrenia, childhood disorders which include autism, ADHD, etc. Bipolar disorder, psychosomatic complaints. No improvement in the individual therapy can able to alter or switch over to family therapy, and those who are having the communication problem. So these are the areas where we can able to promote the family therapy. So here some of the contraindication which will take part in family factors and therapist factors. The family factors which will processing on breakup. Okay, the process which will be getting breakup and lack of family interactions, family dysfunctioning, and presence of family sectors which will have the extramarital affair or extramarital relationships, and inability to afford the cost and unwilling to accept the therapies. So these are the some of the factors which may disturb the family therapy in the family systems. And the therapist factors, the therapist who is having lack of commitment, inflexibility, poor psychological mindedness, and those who are having the judgmental attitude, the people those who are having the cultural bias, lack of empathy and inadequate training, those who are having the social relationship with the client. So these are the factors which will end up with the family therapy. So the family therapy techniques are family system approach, observation, effect of communication, problem solving, family contacts, reality therapy, psychoeducation. The family system approach, based on the family system, we have to set the family therapy which is based on the goal oriented. So during this time we have to make an observation. So first we want to observe the skills and cultural practice and what is the family background which may have a good effective treatment, and during that time the therapist is supposed to have a good effective communication which will interrupt the family systems if they are not having the good communication. If well communicated, it is easy to attract the family members to get involved in the family therapy. And the main most thing is we want to go for a problem solving technique, and all the family members get to be contact and they have to orient about what is the reality, and based on the reality how we have to react in the society. This will be encouraged the family members to get into the therapies. At last we have to give the full detail about the systems and how it is going to be occur and what are the ways we can able to modify it which will give the good results. Here the role of nurses, the nurse supposed to prepare themselves regarding the family functioning and traditional clinical triage which is going to be effective, and here the traditional clinical settings and non-traditional clinical settings supposed to be notified by the nurses. In addition, they have to enhance their knowledge, skill, creativity of the family complaints which will improve the livelihood about the complications of the family interventions. The nurse at this point, they are supposed to be generalized and specialized, which they have to be preparing by themselves, which will be contributing the implementations of family interventions which will help them to get a good results. And not only that, they have to focus on research and educational aspects. So here we are getting into the conclusion. It will be very clear that family therapy which plays an important role for the treatment and rehabilitations of mentally illness and mentally ill client, those who have a better life. Hope you all understand the family therapy. Thank you.